Good morning, good afternoon, and good evening, all of you who are joining from different parts of the world. I'm Satish, I'm the head of program for ATscale, and I'm dialing in from Geneva, from Switzerland. A very warm welcome to all of you to this discussion series on market shaping in the assistive technology sector. This is the third webinar on this particular topic, and the focus for today's discussion is on market shaping at the country level. This webinar is co-hosted by ATscale and WHO Regional Office for Europe. We began this whole market shaping discussion series to look at different aspects of market shaping in the assistive technology sector. One of the questions that are often asked by countries and policymakers and partners is what tools, what frameworks, what approach can help us to practically think about market shaping at the country level. And today's session will specifically try to answer that question and share some of the tools and guides which are available with focus on assistive technology sector, on efforts which can be done with regards to market shaping at the country level. We'll also look at some of the examples coming in from Central Asia and South Caucasus countries. Today's webinar is more designed to be a learning session, so we very much look forward for an active discussion. Before we begin the webinar, some housekeeping notes, which I'm sure we all are fully aware by now, but just to remind, this particular webinar is of 90 minutes and will finish at 12:30 Central European Time. Please keep your microphone muted all the time. The webinar is being translated live into Russian, English, Mandarin, and French. Please click on the interpretation button at the bottom of your Zoom screen to access them. There is also closed captioning available, and it's available in all the UN languages: English, Russian, French, Spanish, Arabic, and Chinese. Please click on the link which will be posted in the chat now to access these closed captioning. The webinar is recorded and will be shared publicly after the event. For any questions, please drop them in the chat. We have team members and colleagues who are monitoring the chat and the question answers, and they will try to respond in the real time we will take up the questions during the question answer session. If we are unable to answer the questions during the webinar, we'll ensure that we get back to you individually after the webinar. Please also use chat functions to provide any general comments you may have. Any feedback, any comments are more than welcome. As mentioned earlier, so in today's webinar, we'll have a deep dive on country level efforts on market assessment and shaping. This particular tool was developed by WHO Regional Office for Europe with support from ATscale. This, following a bit of better understanding of this tool, we will have also perspectives from the government, and we are very grateful for representation from Azerbaijan and Tajikistan to provide government perspective on the use of this tool and practical application of this tool at the country level. And following that, we'll also have a global perspective coming from China on the country level, as well as service provider and user perspective on country level market shaping. And at the end, we'll have time for question and answers. So without taking further time, let me invite Dr. Natasha Azopardi Muscat, who's the director for the Division of Health System at WHO Regional Office for Europe, for the opening statement. Can we have the AV, please?
Just 1 second. We are turning on the AV. Just 1 second.
Yeah.
Dear colleagues, friends, thank you for joining us today for this important and timely webinar. This is the third webinar in our joint series on market assessment and market shaping for assistive technology, co-hosted with our partners at ATscale. And let me start by expressing our deep appreciation to ATscale, because over the past 2.5 years, as WHO Europe, we have greatly valued this partnership and collaboration, because together we have advanced both the evidence base and the practical tools for shaping assistive technology markets. We look forward to continuing this collaboration for many years to come. And if I may add a personal note, it is especially meaningful for me to see my former colleague Satish chairing this session today. At WHO Europe, we've worked intensively to advance learning on market assessment and shaping in the assistive technology space. We have carried out detailed market shaping assessments in Azerbaijan, Georgia, and Tajikistan, each accompanied by comprehensive reports. These country experiences show us that while each market context is unique, all offer opportunities to ensure greater affordability, availability, and quality of assistive products. Our efforts are expanding further, and in Ukraine we will soon be conducting a dedicated market assessment on prosthetics and orthotics, building on the lessons learned from our earlier work. It is important to stress that while we have focused on these countries so far, WHO Europe's mandate covers 53 countries in total, and every country has the potential and indeed the responsibility to participate in shaping the market for assistive technology. WHO's role in market shaping is not new. We have long-standing and established experience in helping countries to reduce costs, lower barriers, and expand access for commodities such as vaccines, diagnostics, treatments for HIV/AIDS, tuberculosis, and malaria, essential medicines, family planning, and reproductive health products. Today, we are applying those lessons and principles to assistive technology, an area that is fundamental to equity and universal health coverage, not least in view of the fact that so many populations across the world are aging, and so many older persons also benefit from these assistive technologies. Not just a technical task. Let us at heart remember that this touches upon social justice and health equity, because it's about ensuring that all people, regardless of where they live, what resources they have, they can access the products they need to live dignified, healthy lives at all ages. And as we are currently finalizing our healthy aging strategy in WHO Europe, given that 2/3 of those needing assistive technology are older persons, access is central to maintaining functional ability and allowing people to age in place, in the places they know and they are comfortable with. Today's session is also special because we are extending the conversation beyond Europe to a global audience. The challenges we face are shared. The opportunities are collective. So through collaboration, governments can shape private sector responses, foster stronger markets, and ensure assistive products reach all who need them. So let me once again close by thanking our partners, particularly the governments of Azerbaijan, Georgia, and Tajikistan, for the openness and collaboration. Thanking ATscale, our speakers, and all contributors who will enrich today's exchange. And most of all, thank you to the participants for joining us, lending us your time and your ear, and strengthening your commitment to advance this agenda with us. Thank you.
Thank you, Natasha. And it was nice to see and hear you both. And thank you for also giving example of how this tool, which was specifically developed for few selected countries, is now being applied in other countries in the WHO European region. This does highlight the importance, the need, as well as the importance of this kind of tool with focus on market shaping. And I think you also very well reminded us that this is something which is not new with regards to market shaping. This has been trialed and tested in the health sector, and it's now time that we learn from that, use it in the assistive technology sector, learn it further from them, and scale it for other countries in terms of its application. So thank you very much for joining and those opening remarks. Now let me invite Adrian Sullivan, who's the market shaping specialist at WHO Regional Office for Europe, for more insight on this particular tool, the tool which is focused on market assessment and shaping in the space of assistive technology. Adrian, it's very nice to have you here, and great if you can help us to understand the tool better and what it is and what goes beyond. And specifically, what are the key principles and concepts on market shaping at the country level, and how countries should learn when applying this tool in their work? How does it then translate at policy level and service provision areas when we apply and learn from the findings of this particular tool? So over to you, Adrian. Adrian, I think you're muted.
Sorry, thank you very much for the introduction, Satish, and it's a pleasure to be here. Good afternoon, good morning, good evening, everybody. And I'm going to try to take you through the guide for assistive technology. And it's been an interesting journey developing the tool, because my experience with assistive technology started a few years ago. And my question that I was asking a lot of people is, when you're talking about assistive technology in the market, is it not enough to have a product? Does it matter whether the product is ill-fitting as opposed to having none at all? And the answer to that question is very clearly no. You need a proper fitting product. And one of the things about market shaping and the market of assistive technology is that you can characterize it by it being very fragmented and very, very complicated. And also to the fact that it's not a market per se. It's a plethora of markets, because one cannot look at the market for hearing aids in the same visual with the same understanding as the market for wheelchairs or prosthetics or eyeglasses, because every market is highly dependent on a very complex environment with highly skilled individual, highly skilled services. And of course, everything is tailored to the person. So when you look at the market for assistive technology, it is something to be taken very seriously, because it's obviously a market that needs to be developed in many areas, whether you're looking at the national, whether you're looking at the regional, whether you're looking at the global, because everything is interlinked. Can we have the next slide, please? So when you have such a complicated market with so many dynamics, one has to unpack a little bit what we mean about the market per se, because one of the key things, it is not a market that's for consumerism. It's a market that's highly dependent on services and the rehabilitation sector linked to the Ministry of Health and Ministry of Social Welfare. And so a lot of it depends on the demand and the needs that are driven in the country. And so to look at that, the first and foremost is to be able to capture and map the needs versus the coverage versus the demand. And it's not enough to have generic percentage ratios. You need to be able to have substantive data, because that is what a lot of the suppliers need to look at when they articulate how to engage with the markets. Some of the attributes we look at to understand the market is whether there is a sufficient diversity of suppliers. We also look at the quality standards that exist in a country or that exist in terms of the regulatory environment for what we need to source and make available and access. And of course, another key thing is the distribution system of how these assistive technologies get to the users that need them through identification, through product choice, and the diversity of that, because a lot of the issues are related to a person-centered approach, because they need to be able to be empowered to choose what product they use for them. As a result, everything is so tailored to the individual. Quality regulatory standards are absolutely critical, as well as looking at the materials used, because these things are very much subject to pricing, sourcing. We're living in a world where there's a hyperinflation in many regions where nothing is available in the quantity, quality, and volume that we need. And so pricing becomes a critical determinant in terms of access and affordability. So these are some of the attributes, as well as the market opportunities for service providers and suppliers to enter the market. Many other countries, in low and middle income countries, the market for assistive technology is very, very limited, or still in the process of developing. And so the maturity of the market still has a long way to go. And we see that in many of the examples that we have been able to assess. Next slide, please. So when it comes to looking at the market and we try to identify, okay, so what are the critical drivers that influence the market? It is very much looked at coverage, affordability, the level of competition, the way items are delivered, and of course, the financing and the availability of funding to be able to cover the cost. Because one of the key things about the markets that we address is that it's not a market that has products for consumers. It's very much a business-to-business market environment. Many of the items that are procured are not only sourced and financed by government, but it's also components that go to other manufacturers to be able to make the assistive technology. So behind the supply chains for countries, there's also the supply chains of the manufacturers and the producers as well, because many of the components, there's many chains in the link. And so that understanding of the supply chain and delivery systems are very, very important. You then obviously have quality and coverage. And the coverage is important because one of the issues is that as we're going to go forward and markets are going to grow over the years, we need to understand that the capacity of the suppliers is going to be able to meet the need as these needs grow over time. And of course, it also depends on the level of utilization. One thing is having the product, but then the other thing is how these products are used. So these are some of the critical drivers that affect the market forces behind assistive technology, but also it's also important to understand that everything is interconnected. Nothing is in a silo. Everything is very much hinged on the other. Next slide, please. Before engaging in assistive technology, and obviously this guide is very much focused on this particular area of work as opposed to much more generic markets everywhere, is that there needs to be a number of preconditions for market engagement to work. And it's not a short play. Market engagement, market shaping is a medium to long-term engagement because we need the sustainability built into that. And so the government needs to be ready, there needs to be support, and there needs to be encouragement. So the ownership of any market shaping engagement has to be with government support. But at the same time, when you look at this sector, you cannot disconnect the role of the private sector in market shaping strategies, because even though the government heavily influences the rehabilitation side, the services side, the health side aspect, the private sector are very much behind the forces that drive the supply, the demand, the availability of the equipment, what equipment they deliver. So it's a question of who decides what comes into a country. And this is a big question for the government. Do they take from the market, or do they demand from the market? And this is where the role of regulatory environments and quality standards and minimum pricing comes in, because we see in many countries that because it's a market that has been neglected for many, many years before the Convention on the Rights of Disability of People about 20 years ago that made it much more visible, which gave visibility to it. It's a market that was heavily controlled and dominated by the influence of private sector. And we see that in many of the consequences as a result of the regulations that were drafted and made. So this is an issue that we're going to address on as we go through the slides. But the private sector is a key thing, because whatever you do in a market shaping environment, it means a choice. There has to be a trade-off and there has to be a decision. And some of these decisions are going to be difficult for the government to make, because obviously it affects, you will always have one effect in the market. If you change one thing, there's going to be consequences. So it's very, very delicate. But ultimately, everything hinges on there needs to be cooperation and collaboration. And if there's one thing that I want to share with everybody on this webinar, is it's about cooperation and collaboration. And this is where the best achievements can be done, if we can find wins that everybody can see the benefit of the need to change the current environment that we often see as a characterization of the markets we affect. Next slide, please. So the steps that we take to look at market shaping, which are similar to the steps we would take in any market assessment, but obviously with a lens very focused on assistive technology, is that we look to identify what targets we want to achieve in the market. And so that means we need to map the demand, map supplies, map key stakeholders, and start to understand exactly what is the character of the market in that country, to be able to then undertake an assessment of the market drivers, to understand what are the market shortcomings. Those market shortcomings, you need to then understand what is the root cause and the driver for those market. What was the cause to result in that market being the way it is? And often you see in many countries, for example, there are monopolies where you have single source suppliers, or you will have certain regulations, and those regulations are tailored and made to reflect the needs of a particular area, particular stakeholders, as opposed to it being much more open, much more free, much more competitive. So those diagnostics are really important, and you do a root cause analysis for many of those aspects, because you can't do all. And therefore, you need to prioritize what market shaping options you need to address, because there has to be a prioritization. And of course, there has to be a sequential planning and a roadmap of sorts to be able to look at where you want to get to and what it is you want to change. Maybe it's a regulatory aspect. Maybe it's to do with financing and availability. Maybe it's to do with engagement or diversifying the market entrance, or maybe it's to do with a combination of all those three. But ultimately, once you have those market shaping priorities and options, you then go through market shaping interventions and then monitoring and evaluation to make sure you track the changes. Next slide, please. Unlike any other market, one of the characteristics about assistive technology is the level of stakeholders involved, which is very diverse. I mean, of course, you have primarily the governments, who are the main key drivers in shaping a market, whether it's through regulation, but you have the Ministry of Health, you also have Ministry of Trade, you have Economic Affairs, you have the Ministry of Finance involved. There are a lot of different governmental departments that are instrumental in looking at how markets for any product, including assistive technology, is developed and nurtured in a country. But then you have to also include the users, where users are the key drivers behind those that are the beneficiaries of this technology. And one of the issues we have had in the past is that their voices have often been silent. They take from the market, but they need to be able to also ask from the market according to that, because one of the things about assistive technology, which is unlike any other market, everything is bespoke, everything is tailored, everything is made to order, everything is designed to the individual. It's not off the shelf. Things are not made to stock. You can stock the generic, But once you get that supply, you have to mold it to fit to the individual. And therefore, the dependency on the rehabilitation services, the dependency on the Ministry of Health, the dependency on the social welfare workers is absolutely critical in informing not only the user, but informing and guiding the suppliers. Because without that, you are going to have an ill-fitting product that is not going to be fit for purpose for the people that need it. But at the same time, the suppliers are key. You cannot have a market without the suppliers. And behind the suppliers, you often have financing complementing government, which comes from the international and non-governmental agencies who are also key drivers and influencers. Because as you know, the source of the money has a huge influence in what gets funded, what gets decided, as opposed to especially if there's a non-regulatory environment or if the engagement from the government in terms of the whole approach to assistive technology is not a prioritized agenda, then the influence goes on to the international non-governmental organizations. And of course, the health system is critical. Not only the health system in terms of the delivery of healthcare services, but it's also the support services behind that, the pharmaceutical support services, because very often the availability of assistive technology comes through the pharmaceutical suppliers that deliver diagnostic equipment. Assistive technology is like often a niche area attached to medical equipment, and the people behind that are not informed, they're not specialized, they're not skilled. They look at what sells, what moves, what is available, and they will not buy something if it doesn't sell. So therefore, it comes back to the information of the user. And of course, you have the involvement of the academic research, engineers, designers. So it's a very wide level of stakeholders, and we need to consult with all of them. Next slide, please. But beyond the stakeholders and the determinants, there are a number of key areas that are hugely influential on the assistive technology market. And that comes on some of the things related to, I would call it the political side, which relates to the governance side, the government and the relationships with business, and how that then influences the assistive market technology, because there's a lot of areas in that. As it's a market that's still in development, you still have, in many instances, a very controlled environment, I would say it that way, between the business sector, the government sector, the regulatory environment. And of course, these are niche markets. So there's some fierce competition in there to gain market share and market control. And so this is something we need to be aware of, because it affects many, many countries that we work in. You then have obviously the purchasing power of people in terms of making it affordable. But then comes the social aspect of knowledge, attitudes, practices, and behavior. And this is key because it relates to information. The more information you have, the more you're empowered to make decisions. There's nothing worse than having a decision-making approach to something where you're not empowered with the right knowledge. And this is where the whole knowledge and information is a critical aspect of any kind of market shaping. But it's also a market that's determined and characterized by high innovation. There's a lot of innovation in the assistive technology market, and it changes every year. You just have to look at the world of prosthetics and how prosthetics with the bionics and the electronics, and it is every you blink an eye and there's new technology. Even when you look at some of the issues of hearing aids, the technology now is being so minuscule. You don't make a hearing aid without it being produced in a lab. So the level of technology is a critical aspect, and you need to keep it abreast of where these are. But then there comes the sustainability and the environmental aspects, which I will come on to a little bit. But ultimately, anything in the assistive technology market hinges on the regulatory environment. If there's two levers that one can market shape, as you alluded to before, and WHO has a long-standing history of this, is on the regulatory environment, and of course governments on the financial, and the two come together. And ultimately all these things need to be discussed and brainstormed, for there needs to be a collaborative approach. Next slide, please. One of the key things that I just want to call out, because it's a bit of a personal issue that I see in many of the markets we look at with assistive technology, is on sustainability. We're looking at sustainable development goals. We're getting now 4 years away from 2020-30, and we're still way, way, way behind where we need to be in terms of achieving those. And one of the areas of responsibility is obviously from government side, but also private sector side on how to address sustainability. We see that now the level of technology in many of the products are high end. Also, we see that there is a life cycle where you don't just get one item for life. You get one item and it has to be renewed every 3, 4, 5 years, whether it's a wheelchair, whether it's a hearing aid. You need that product to evolve with you. Sometimes you come for not only the primary, but then you come to several, after several years, it needs to adapt to you as a person and how your disability evolves, but also your age. But we throw them away. There's no really well-developed approach to recycling. And so the whole disposal, recovery, recycling, and return. I mean, if you look at a wheelchair, for example, and we say it's got 5 years, well, the cushion needs to be replaced every year. The padding needs to be replaced every 2, 3 years. But the metal frame, the metal frame can be reused. And if you take care of it, it can be reused. And there are many examples. There's one particular example that I saw in Georgia, for example, where the whole business model is based on not selling, but providing for use, and then it is recovered when the person no longer needs it. It's recovered, repaired, rehabilitated, re-put to standard, and then reallocated. And so there's a lot of opportunities, especially for governments that have financing challenges, to be able to look at how to reuse this. And there's many systems that can be built in and many examples that exist of where this approach is done, of course, including Denmark and the UK and many other places. Next slide, please. So ultimately, what it comes down to, Satish, ladies and gentlemen, is that there needs to be an assessment and then a prioritization, because you can't do all. So you have to look at the situation in the country with regards to the market assessment. What are the dynamics? What are the key determinants that affect you most? Very often it's going to be a regulatory environment, because one of the things we see in many countries is that it's not regulated. There are legal bounds in regulation. We're looking at the regulation of services. We're looking at the regulation of skills. We're looking at the regulation of prosthetics training. But we're also looking at the regulatory environment of the assistive technology that we're buying, ISO standards, but also not just ISO standards, but there's also to do with the service level regulation that we need. For example, how do you fit something to someone? And very often it's this area is very, very loose. And of course it's loose. It's up to the beholder to take that decision. So who makes that decision? It is very often either the supplier or it's with the service provider. So you need to be able to look and assess what is the cost benefit for the change you need to be able to affect the market that you have. And of course, you have to look at whether are local, regional, or national issues. Next slide, please. This now comes to theory of change. And this theory of change is just to show you how to frame the process when you look at the investments that is made, you look at the processes that affect the assistive technology market, you look at the outputs and the outcomes you want and the impact. So this is a tool for you to help shape the thinking and approach as to what you want. What you want to change, you plot it in and you look at the cause and consequences, look at the stakeholders, what needs to happen, how it needs to happen, because this ultimately will impact the effectiveness and the access to it and what we call the value for money. And ultimately what you're looking at is a theory of change to help change the availability of care, coverage of care, quality of care, utilization of care and access to care, whether on the rehabilitation side or on the supply side. Next slide, please. Here we have a number of examples. So this example of Tajikistan, and it is not to call out Tajikistan specifically, it's just because this is information that we did recently on an example. And I just want to commend Tajikistan for many of the changes that they have done, because they've got some amazing examples of how they're addressing assistive technology. But this is just to share a visual on what, when you take the market determinants and then you look at what that looks like, you can see in terms of the layers. And obviously, as the layers you go up, you can see that from a healthy market framework, which is work that I did using with the work that I did when I worked for UNICEF in terms of developing healthy market frameworks and market influencing strategies back in the day. You can see that from the very start, you need to be able to identify whether established demand is articulated, because without that demand, you're not going to be able to make any difference. Then you have the supply, and you look at how that meets the demand. And one can see that on many, many, many levels. It's not just one market element, but several of them. And obviously, the higher up you go, the more complicated it gets in terms of looking at product innovation, looking at diverse local production and long-term competition. But ultimately, this is an example we see in many countries where many of the determinants in countries are affected by attributes that need to be developed or offer challenges to be able to address. Next slide, please. And ultimately, it comes down to obviously implementing interventions. And I break these things down into 3 core areas, with obviously a 4th one on the side. But we are looking at reducing costs. Now, it's not about reducing budgets. It's not about reducing the availability of funding into the market of assistive technology. It is about ensuring that more gets done with less. How to make that dollar go further. Because once you start addressing the assistive technology, you realize that one of the things that is very little what is not done is on planning. There's very little planning done in procurement. How you buy something is as important as what you buy. One thing is buying a wheelchair, but what is critical in market shaping is how do you procure? What is your planning and strategy to access supplies? And you do that over term. And so that is where the information, because it's very ad hoc. We see in many countries, procurement and orders are ad hoc. They're not planned. They're case by case. Someone comes in, they have a need, you define the need, then you order the item. It's not done on a systematized process. And then you have to obviously balance the demand and supply. And all of this hinges, Satish, on the availability of information for people, because if there's one thing that is asymmetrical in the assistive technology market, is that no one has full handle on all information. There are bits. Some are technical, some look at the market, some look at a very specific niche area, but then that global overview is lost on many of the countries and stakeholders and engaged. They have very narrow view, but they don't see the whole, because all of this comes down to influencing finance. How do you use the money? One thing is the government being asked for money, but the government also needs to understand how to use that money that brings the biggest return on investment for the actions they need to undertake. Last slide, please. You then also need to look at the risk mitigation strategies, because nothing exists in a silo. No assistive technology market exists only in a local area, because there are many dynamics, and we look at the effects of supply chains. COVID-19 taught us very, very harshly how the supply chains, when it affects in one region, how it affects us in another. And so one of the areas is how we mitigated that risk is by diversifying supply, regionalizing, localizing supply, and not being dependent on one single source. The same as we don't want to be dependent on single source supply, we don't want to be dependent on single source supply chains. And so therefore we need cooperation and collaboration, because nothing is produced in a country without depending on imports of components, importing of skills, local fitting, local production in terms of components being put together in assembly. We need to collaborate and cooperate. Hence my messaging to everybody. It's not about my area, this is my niche. No, we have to work, because obviously to do with financing. And one of the issues about the risk of financing is to diversify financing, not having it only depend on government. We have amazing examples in the region where banks come up with microfinancing loans to people to support them with their out-of-pocket expenditure to be able to afford technology that is of high standard. But because it's unaffordable, they then spread out. So microfinancing. We also have amazing examples. Look at Azerbaijan, for example, and the work they did in the reform of the insurance system, where they've included assistive technology as part of the insurance packages. We also look at the involvement of private sector, because what we forget is the owners of private sector suppliers are also part of the community, and their whole role and involvement in corporate social responsibility has made an amazing amount, where they also look at contributing to communities to be able to make things affordable and accessible. And so you need to diversify that range. The geopolitical and regulatory risk is very, very important, and I cannot stress enough, because what we see is that because these markets are very, very tight, there is fierce competition to be able to control markets, to be able to control demand, and also that links in controlling referral systems. It's not just about the choice, but it's also, there are areas where the whole free market dynamics does not exist in the assistive technology market. And we need to ask ourselves, what is the area? Because it's been neglected for many, many years. You have a number of actors that seek to dominate, seek to control and dominate market share, because the small markets, that's how they get their volumes and economies of scale. And so this is a very, very important area. And of course, quality performance issues are key, because if you don't have a choice, you don't have a regulatory area, then you have quality risk. That then comes back to you as the user. It comes back to you as the source of financing. It also comes back to you as a supplier. So that whole regulatory risk and quality performance is very, very important. I leave it there. Sorry for going over and for talking fast. I wanted to get it into time, but I'm open for any questions, and just thank you for listening. Satish, it's always a pleasure to see you, as well as Ranjavati. Thank you.
Sorry, Satish, you're muted.
Can you hear me? Yeah, perfect. Okay. No, so I was saying that, Adrian, it's always a pleasure to see and hear from you. And thank you very much for clearly helping us to understand the guide better, and the practical use of the tool at the country level. Some points which really struck to me was the emphasis which you made that every market is unique. The translation of need to coverage to demand, which is fundamental in expanding and strengthening the assistive technology market. The importance of the attributes related with healthier assistive technology market, I think is a very important point. The point on that nothing works in silos in markets, and I think that's a real emphasis which we all need to keep in mind. The precondition for success, the difference on how to take and demand from the market, and I think these are two different skills which needs to go together, and the 6 steps on market shaping, and your emphasis on on regulation, the emphasis on diversification of suppliers and finances, as well as that this is a approach, a tool, a guide, which then needs to be adapted to each and every country, whoever wants to use it. And lastly, which is fundamental on market shaping, is collaboration and cooperation. The engagement of AT users, the private sector, the government, and development partners in that journey is absolutely crucial. So thank you very much, Adrian. Now let me go to the governments and have government perspective on country level market shaping. I invite colleagues from Azerbaijan and Tajikistan. I'll have 3 pointed questions to both the colleagues from Azerbaijan and Tajikistan. One, the first question is, what are the key lessons that the government has learned from assistive technology market assessments at the country level? What are the next steps which the governments are thinking with regards to further strengthening the market, assistive technology market at the country level? And what would be the recommendations from Azerbaijan and Tajikistan to other government partners and stakeholders who are listening in today's webinar? It's a pleasure to invite my good old friend and colleague, Professor Dr. Vugar Mamadev, who's the Deputy Chairman of the Board, State Medico-Social Expertise and Rehabilitation Agency at the Ministry of Labor and Social Protection at Government of Azerbaijan. Vugar, very nice to see you. Over to you to have your insights on the 3 questions.
Thank you very much, dear Satish. I'm also happy to see you, and I would like to greet all participants today and thank WHO for this platform where we can meet our colleagues also from regional countries. We greet all on behalf of 12 people attending from Azerbaijan at this today webinar. I represent agency which is the leading national state agency on disability and also in the assistive technology sector. We are responsible for assistive technology sector in Azerbaijan, working with the people with disability. About 500,000 people are certified in Azerbaijan with disability, and they all get support from the state by monthly disability pension, but also free of charge rehabilitation services and assistive technology and assistive products. So last year, 125,000 people, they used our rehabilitation services and have been provided assistive products through 17 rehabilitation centers throughout the country. This year, we forecast 100,000, 40,000 people, which is 10% increase. We offer them inpatient and outpatient rehabilitation services, mobile services at home, social psychological aid, telerehabilitation and online consultations, but also for full provision and replacement, renewal of assistive products, but also different other projects like yoga classes, danceability, etc. So 70% of our staff in agency are people working for rehabilitation and assistive technology. It is about 1,000 people throughout the country. The key institution responsible for AT in Azerbaijan is Prosthetic Orthopedic Production and Rehabilitation Center under our agency. This is responsible for local production for PO, but also state import and provision, distribution of all kinds of assistive technology to people with disability. In post-Soviet countries, this is one of the oldest. Soon we will recognize 100-year anniversary of this provision of prosthetics in Azerbaijan. And nowadays, it is one of the leading and well-equipped centers cooperating with leading world PO world companies. So this institution has been actively participating in the surveys and assessments which you mentioned. If to mention these surveys, it helped to the country a lot to update our state-provided assistive product list, which was updated by our minister and WHO, starting from RATA assessment in 2021, which shown that 24.7% of Azerbaijan's population in need of AT, and they have low AT awareness and low knowledge of modern assistive products. In 2022, WHO supported ATAC and STARS service in Azerbaijan, ended by consensus meeting, which updated our national assistive product list and increased number of assistive products from 33 to 81. This update was done within WHO recommendations on assistive products, removing medical products from the list and bringing new products for vision, hearing, communication, and self-care domains on top of traditional mobility domain. So last year, with these updates, 97,000 assistive products have been distributed free of charge to the people with disability. And for this year, we expect a 45% increase, which is a very significant number with enlargement of this list. So as you mentioned, in August 2024, this assistive technology market assessment was conducted in Baku with the support of WHO Europe. The report now under review by the ministry, it highlights the critical importance of cooperation and collaboration to expand access to assistive technology and to improve the quality of products and the services. I think it is the key message from this assessment we are getting. And as key recommendations, first, enhance coordination across ministries, agencies, user associations, and the private sector. Second, strengthen services by providing training, follow-up, maintenance, and repair. And third, invest in people by building and recognizing the AT workforces and raising public awareness. The other recommendation is, of course, regional cooperation is very, very important. In November 2024, to build this effort, a sub-regional technical workshop on assistive product specifications and quality standards was held in Baku, brought together stakeholders from Azerbaijan, Georgia, Tajikistan. The month after, we visited Turkey also to learn the Turkish experience, which is very close also with our ministries. And actually, to respond to your question, what is the next step? It is our next step. We will work on the elaboration of specifications to increase the minimal standards for the assistive products are coming to the country. In general, to conclude, Azerbaijan's strength in this sector is strong political commitment and support of the ministry on the level of leadership and the government capacity, which makes a solid foundation for advancing assistive technology initiatives. With technical support and clear guidelines coming with support of WHO, these resources can be leveraged to expand access to assistive products, improve service quality, and foster a healthier and more sustainable assistive technology market. So looking forward, as many other countries, Azerbaijan market still requires support to diversify and achieve a better balance. And as Adrian mentioned in his excellent talk, that this can be achieved through increased cooperation and collaboration, both regionally and globally, to shape the private sector and reduce market and procurement fragmentation. Thanks for the time. This is all from my side. Over to you, Satish.
Thank you very much, Vugar, and thank you for also helping us understand that this particular guide could re-emphasize the importance of interministerial coordination and collaboration, and how governance around assistive technology can be strengthened. The importance of inter-country cooperation and collaboration with other countries, as well as how this tool has emphasized again the need of strengthening the specification for various assistive products. Also, you did alluded that the market assessment guide also helps in the diversification process, which is required for provision of assistive technology. So thank you very much, Vugar, for those insights. Now, from Tajikistan, it's my pleasure to invite Mr. Yusufzoda Fakhreddin, who's the head of Social Protection Department at Ministry of Health and Social Protection, Government of Tajikistan. Over to you, Yusufzoda, and my question remains the same. How the guide was used in the country, what the government has learned from it, what are the next steps, and what will be your recommendations for other countries? So over to you, Yusufzoda.
Спасибо огромное.
Many thanks to you. So good afternoon, dear colleagues and partners and friends. Best regards on behalf of all the Tajik people, of all those who work at the Ministry of Health and Health Protection of the Republic of Tajikistan. I would send best regards to Mr. Satish Mishra for his great contribution, because during visit to our country, interacting with the country WHO country office, so he has done a lot for us, and we shall always remember his contribution. And we're truly happy that our cooperation continues, and we shall do our utmost to expand it. Thank you very much again, time and again, Dr. Satish Mishra. So, dear colleagues, it's a great honor for me to present our findings in terms of assistive technology introduction with the assistance from WHO. This work reflects our common commitment to what we're trying to do with people with disabilities in Tajikistan, and all those who could make use of the assistive products, they would enjoy wide access to the needed products and services that make it possible for them to lead a healthy and independent lives. So all the survey was consisted in detecting our limitations and drawbacks, including regulatory and financial barriers. And we collected the data on the basis of the literature review, and also visiting the institutions and conducting interviews with the stakeholders in November 2022, also including suppliers, both from public and private sector, and also with the users and also other government agencies. During this assessment, we paid special attention to three priority groups of products. These are the wheelchairs, hearing aids, and prosthesis and orthesis. The main target boiled down to the fact so that we could formulate the recommendations for the government of Tajikistan to improve access to assistive technology by way of more effective procurement and programs. During that survey, we made the following conclusions. Coverage still remains pretty low against all types of products. Of course, the users have a limited choice, especially regarding the wheelchairs and prostheses. In the quality assurance system, so it requires improvement because some products have a very short service life, and the majority of products are imported mainly from the Chinese, from China. So as to the hearing aids, so the quality of those is controlled by a few private clinics, and the only supplier is the government, is the state. As to the wheelchairs, so the supplies are concentrated with the government and partners, development partners, and there are also several importers of medical products. As to the maintenance and services of assistive products, it is organized, but it is not accessible to all. And there is a serious shortage of qualified personnel. Of the government, I may admit to say, of course, they are taking measures in order to adopt the relevant recommendations. To be more precise, we are now developing technical specifications in order to provide the safety of those products and their compliance with minimal standards. The healthcare workers in the pilot areas, they undergo training on the provision of assistive products in the course of recently held talks regarding financing. And so we have discussed the public-private partnership and potential introduction of the voucher system in this domain. Drawing the line, I would like to underpin that this kind of assessment has become a very valuable tool that has been helpful in terms of planning in the assistive technology sector. So it also underlines the potential role of the private sector. And they also put forward some innovative approaches to more effective use of the government budget. This would make it possible to provide wider coverage of people in need of such products. This survey, as I have already mentioned, was conducted with support of the World Health Organization, and this would certainly help us a lot in planning our future steps in the area of assistive technology provision for all people in need of these products in Tajikistan. Thank you very much for your attention.
Thank you very much, Yusuf, and thank you very much for emphasizing the how this particular guide could identify some of the regulatory barriers and also policy solution with regards to addressing those regulatory barriers, as well as policy planning on strengthening the assistive technology market at the country level. I particularly like the importance of having a phased approach and not going on overall market shaping in one go, but rather having a phased approach, at least in the case from Tajikistan, where it started from wheelchairs and processes and then gradually evolved to other areas and will be evolving to other assistive technology areas. So thank you very much for sharing those insights. It's always a pleasure to hear from you, Yusuf Joda. As we just heard from Tajikistan, and we have been also hearing in the past on different webinars related with market shaping, China is a leader in manufacturing many types of assistive products, such as wheelchairs, eyeglasses, and plays a significant role in providing and shaping assistive technology supply globally. It's a pleasure to introduce Mr. Zhang Hongtao, who's the Deputy Director General for China Assistive Devices and Technology Center for Persons with Disabilities. Zhang, thank you very much for joining. Zhang, if you can help the audience and us to understand how China envision its support for strengthening access to low middle income countries with focus on assistive technology, how this particular tool on market shaping at country level can facilitate and support China and CADTC for partnering with those countries. And lastly, and how other countries can learn from China manufacturing expertise to grow their own assistive technology sector. Over to you, Zhang.
Dear friends and colleagues, hello everyone. Thank you for the invitation, and I thank the moderator for his introduction, and I thank ATscale for providing this platform, enabling us to share China's practical experience and a cooperative vision in the field of assistive devices. China, we have more than 85 million people with disabilities and more than 300 million people with over 60s. So recently, China government introduced the relevant policies for assistive technology, for instance, guiding opinion for assessing assistive technology, and also guiding opinion for improving access to assistive technology. Recently, the government also implemented the recommendations to help assistive technology to be applied. All of these supported policies helped the assistive industry sector to grow in China. Recently, in the development and the research in AT sectors, we have achieved progress. For wheelchairs, according to incomplete statistics, more than 300 manufacturers are registered wheelchair manufacturers annually produce 8.5 million manual wheelchairs and 900,000 electric wheelchairs. These products meet the demands domestically and also export to overseas. We also established the product database containing information for 18,000 products at our center. This year, we actually successfully hosted China International Welfare and Rehabilitation Expo in Beijing 2025, spanning 22,000 square meters, attracted 431 enterprises and institutions from 17 countries and regions worldwide. And many national institutes and buyers found what they need at the expo. And also these products they purchased good quality and affordability to meet the needs of their end users. Through we actually hosted more 20 expos in the for the past years, becoming a platform for exchanges. Our Assistive Devices and Technology Center, CDTC, we actually participated in the compilation of the global report on assistive technology organized by WHO. We also worked with the ATscale on the project of global AT market report for media and low-income countries. Also, we worked with the UNICEF to recommend assistive technology. This year, we have 15 participants from Uzbekistan and Tajikistan came to China to participate in our International Welfare Expo and also gained a relevant capability during the expo. So we hope the Welfare Expo will become a very good platform for international exchanges and also play a positive role in assessing the AT market. Therefore, I would like to take the opportunity. I recommend that WHO ATscale should continue to play their role in promoting the growth of AT sector of the world, and also in help countries to improve policy development, improve cooperation in policy development, information construction, standardization, and talent training. Thank you so much for the opportunity. Thank you for your attention.
Thank you, Zhang, and thank you for emphasizing the importance of policy development and in recalling and also reminding us that those are important efforts and needs to continue at the country level. And of course, from ATscale and I can surely speak that also for our partner WHO, that is a priority in many countries where we are active. You also alluded on the use of the tool at the country level, especially in Central Asia, which also helped them to cooperate more with China, visit China for the AT exhibition, where they could see more variety of suppliers and manufacturers of assistive technology, and that can help in further linking for cooperation among the countries with China. So thank you very much. Also, very congratulations on all the work happening in China. China is indeed a very important global manufacturing hub for assistive products. Also, thank you, CADTC, China Assistive Devices and Technology Center, for live streaming of today's webinar in China. So thank you very much for that. Now, let us move to a user and a service provider perspective on market shaping at the country level. With this, let me invite Esma Gumbritz, who's a disability rights activist and an AT user herself from Georgia. Esma, if you can help us and brief us on your experiences and challenges that you have encountered on accessing assistive technology in Georgia. Some of the specific challenges which you see around access to assistive technology, especially for girls and women. And if you have a crystal ball, and if there's one thing that you would like to change, what would that be? Over to you, Esma.
Thank you very much for this question, and I hope I'm being heard quite well. And thank you for giving me the floor. So first thing is I will be mainly focusing on the white cane, just because this is the only assistive device so far that the central Georgian government funds for the blind people. According to the WHO's reports from the 2023, only, it's the only out of 14 provided devices. It's the only one provided for the blind persons, while 11 different devices are provided for persons with mobility impairments. So there is already a recommendation that assistive devices for blind and partially sighted persons should be more diversified. I know that in few different municipalities, other smaller devices such as audio thermometers or tonometers or glucometers are also funded, but there is a debate whether or not these are assistive devices or medical devices, and this is one of the barriers that hinders the provision of them on the central level, as far as I'm aware. We are provided a standardized types of white cane. There is a possibility to choose between the different lengths of the cane to adjust for person's height. But there is no possibility to choose a tip or handle, or generally saying different types of a cane. As we know, the UN Convention on the Rights of Persons with Disabilities gives us the right to choose the AT we need, and also the Article 20 personal mobility talks about it explicitly, but also our Article 9 about accessibility and innovation. This is why it's very important that blind persons are allowed to make choices when they pick up different canes, because there are different tips, different handles, as I mentioned, also different amount of folds in one cane. So there are a lot of specificities that people choose depending on their living circumstances. For example, certain canes are good in the cities, while others are good in the countryside, in the rural areas, for different types of surfaces, let's say. When people are given the white cane in Georgia, there is also a minor training attached to it. But me personally, I was not really able to benefit from it because I already was given some mobility and orientation training abroad while studying. So I didn't need like a basic training. This is something more suitable for first-time users. And my suggestion for all the countries is that instead of calling it a training that is attached to the white cane provision, it probably is more suitable to call it a fitting process. Because in the fitting process, you, as a user, you could be exposed to different types of canes, and you would be able to choose which one and which, I don't know, tip and other accessories suit your needs more, and you could be consulted on this. However, we should not underestimate the importance of training. But the training is to teach someone mobility and orientation from scratch. It is quite time demanding process, and but a very important one, which we unfortunately so far we don't have in Georgia outside of the specialized school for the blind. So if an adult loses the vision, or for instance, for me, I was not provided mobility and orientation training during my school years because I'm older relatively. So I needed to learn it somewhere else. And in my case, I was lucky enough to be able to study abroad and receive this training. However, of course, most of blind and partially sighted persons are not. So it's important that this training is included and state funded, because this would actually mean lower state spending on personal assistance services. What I see currently in Georgia happening is that most of the blind persons are requesting personal assistance. There are long waiting lists because obviously the state resource cannot fulfill the whole demand for the personal assistance. But most of these people, if they have been taught on time, they would be able to be more independent and rely less on the personal assistance and require less hours, maybe, of personal assistance. I don't know any country in Europe where blind persons are fully relying on a state-funded personal assistance. It's this kind of service usually is requested ad hoc in emergency situations, maybe for a few hours a week, not to accompany a blind person everywhere. But this is because they are given appropriate and individualized, tailored AT, assistive technology, and also are also provided with the training that teaches and empowers them to be more independent and to use it more. Because together with the training, I think it's the counseling is also very important, the psychological counseling, especially for persons who lost their vision recently in the adult age. Because unless these people find courage, find emotional resources to dare and start independently, it is very hard to persuade them that this is possible. And this would create more demand for the white canes, because right now we are in a sort of a vicious circle where we do need individualized and tailored white canes. However, the demand is quite low. And because the demand is quite low, it's hard to, let's say, rearrange the state programs in a certain way. However, so this is why I would recommend a complex approach, providing mobility and orientation training services together with the white cane, and also adjusting the white cane provision service in a way that a person is able to choose and pick up the cane that they need. And in this situation, we may need also to have a co-funding mechanism, which could also be very good for more expensive AT in perspective, and a very important one, because some blind persons may choose to have canes that go beyond the state provided limit. However, in this case, it would be very valuable for these persons to have a possibility of co-funding and not being forced to bear the whole costs on their own. I mean, the costs of the white canes vary from a few dozens of dollars to a few hundreds of dollars. Also, of course, the transportation and shipment costs are to be bared in mind. And there, of course, might be some difficulties in accountability. However, I believe this could be addressed and solved by the government officials. And when we talk about the gender aspect, I would say, and again, this is why mobility and orientation training, but also psychological counseling is important to actually encourage female persons, women to use the assistive technology, is because due to the generally existing traditional gender roles, many families are very worried about women with disabilities who will be going out in the streets alone, relying only on the assistive technology, and who can become victims of sexual harassment of some sort. And in this aspect, of course, there is a difference, not in the AT access itself, but in the attitude towards women using the AT and moving around. I would stop here. Thank you very much. And I'm looking forward to any questions.
Thank you. Thank you, Esma. And then thank you for reminding the importance of on the device itself, and that the device should be tailor-made for that individual's need, and also reminding the importance of services which goes along with that particular assistive product. You also reminded on the the importance on diversification, and I think this is something which Adrian had also mentioned earlier on. Financial diversification is also extremely important, so that the burden of accessing that assistive product does not rely or lie purely on the user who's going to use the assistive product. So thank you very much, Esma, for those inputs. I'll now move to again to Georgia. And nice to see you, Jeremy. To have Jeremy Gaskill, who will bring a service provider perspective. Jeremy is the Chief Executive Officer for MAC Georgia and provides support, education, and resources for persons while building skills and knowledge for their families and communities that care for them. MAC Georgia works at an intersection of local innovation and service delivery. So Jeremy, it's nice to have you. And as a service provider in Georgia, what are the biggest challenges which you see around supply, assistive technology supply? How does MAC Georgia is trying to address those challenges? What lessons can be learned by service providers from what lessons other service providers can learn from your experience? And as I mentioned earlier to Esma, if you have a crystal ball and if you want to change things, what would that be? Over to you, Jeremy.
Great. Greetings, everyone from Tbilisi, and thanks, Satish. It's good to see you too. And thanks, everyone at WHO and ATscale for creating this valuable platform and for including us in our voice. So just to give you a little bit of context and background, we've been working as a local nonprofit in Georgia since 2008. We began working to introduce supportive seating to Georgia in 2016. In our work, we'd encountered numerous children that were unable to use the state-issued basic chairs because of their postural needs. Many others needed to be strapped in with scarves, ropes, other materials. So we began to trial different models, supportive wheelchairs, from around the world. We began to bring in, considering their weight, their cost, fit, durability, transportability. And we ended up settling on a few models based on our observations and the feedback of the users and the families. We really wanted to see what worked best in Georgia. What's available based on the cost, what's available based on, given the urban landscape in Georgia as well as the rural landscape, what was going to be best. So we narrowed it down to a few select devices that we felt met the criteria. In 2022, the Georgia Ministry of Health introduced new guidelines and standards that recognized intermediate seating for those under 18. It allocated money in the form of vouchers, which allowed families to receive both the product and the fitting, which followed along with WHO guidelines, which was huge. Today, we're one of 3 certified service providers in Georgia that are within that pediatric space. So reflecting on the shaping experience, we went through that with WHO here. I think it was very beneficial. It allowed us to really kind of get together as service providers and really kind of think through what works, what doesn't, what our experiences is. We came away realizing that our products are good, but we also, I think, were able to better define the minimum standards as we look into the future for similar products and new products. It also reinforced the need for us to continue to provide service according to WHO guidelines and standards. As far as bringing in products, and the pipeline, the challenge for us has always been getting products in from overseas. There's not a local production of supportive goods. And so essentially, since one of the big issues that arrived was about the voucher themselves. And so essentially what the Georgian government does, the Ministry of Health will bundle the product and the service payment into a single voucher. The cost of those products and service delivery have increased since 2022. The voucher hasn't. And so a lot of our discussions were motivated by how can we continue to provide quality services, while at the amount of money that that's being received. Now, cost and finances are, of course, a universal and perennial challenge, but we're optimistic that the ministry will continue to recognize increased expenses, work with us in the coming months to ensure that they maintain that quality and sustainability. I see it also as an area, as mentioned earlier by Adrian, for us to work with the ministry to find creative ways to reduce costs and to make the Georgian lari go further for less. But again, one of the biggest challenges for us is the shipping costs and the input costs that keep rising as we import products from overseas. Our products come from the US, from China, from South Africa. And so we've seen each of those increase, as things do over the years. And so kind of working with the government to keep those costs in check and to ensure that we keep the quality that's necessary. Another topic that and if I had a crystal ball, I hope what we would see is we would love to see the ministry continue to think about revising the voucher process itself. So right now, when a family needs to get an intermediate or advanced wheelchair, they need to go to a regional expert doctor. That adds additional burden, cost, and time. And so we recognize that there's clear challenges transitioning, but we would love to see the government move more towards the primary healthcare system for those kind of approvals and verifications to be made. Lastly, we're very encouraged by the ministry's readiness to extend supportive seating for those over the age of 18 if they've received an intermediate chair as a child. And we hope that that continues to expand to include even more individuals over the age of 18 who need such support. So I think just in closing, I'll highlight two insights that we've gleaned over the years. One is the value of the hub system. So we've continually struggled to find a way to bring service to the individual where they live, but to do so in a way that allows us to be financially sustainable, to not go over and to not lose money. Establishing regional hubs has allowed us to do that. So essentially, we've created partnerships with other service providers in each of the regions of Georgia. That allows us to travel there, set up shop, and allow families to be fitted close to home. Of course, this doesn't mean home-based service, but it does minimize the travel burden on the families and keeps the quality high and the costs in check. The other thing I wanted to comment on is the importance of educating the user and the family of the value of supportive seating. This kind of goes to the demand side, which is very important, but then also at the provision point, it's really key that you provide them with the information of what the real health benefits are about this. You can provide an excellent chair, you can fit it perfectly, but if the family and the user don't really understand the long-term health benefits, they can quickly substitute it for a less beneficial option, a stroller, a lighter, non-supportive chair, simply because it looks better, it's easier to transport, or other reasons. It's really crucial, and we see this time and again, that the wheelchair users and the families understand the long-term importance of using a supportive chair when they receive it. And I just, ironically or coincidentally, this week, I actually got a letter from a parent. She wrote that she'd been extremely reluctant to switch from a stroller to a supportive chair. She talked about how our occupational therapists, when they visited and supported their child, fitted her into a chair, made it a fun experience. They placed stickers on it. They put colorful balls on the wheels. And she wrote that when they left the office, the daughter begged them to walk home instead of drive home because she loved the chair so much. Right. And they did. And so it's just a case in point, the stigma can't be chipped away, and that education really needs to happen one family at a time. So thank you.
Thank you. Thank you, Jeremy. Thank you very much. And thank you for emphasizing on the education of the user and the communities. So thank you very much. I already see a lot of questions has been asked and responded in the chat. So thank you very much, colleagues, for doing that. Probably I'll pick one question, and if I can invite Adrian. And Adrian, if in a minute, if you can explain, how collaboration can be fostered between countries and how can countries collaborate on market shaping agenda for assistive technology? What practical steps countries can take? So if in a minute, if you can explain that very briefly, that will be helpful. Adrian?
Yes, thank you very much for that question. And it's obviously one of the ones that are at the heart of what I have a passion for in terms of assistive technology, because of cooperation and collaboration. And one of the things is that our markets are very niche. Number two, they're very limited. We often know that they are very, very tight. They are developing. So there's an area. The supply is finite, diverse, fragmented, but equally our visual on demand is fragmented. And this way for countries to cooperate together is, for me, if there's one ask, is can countries work together to pool and visualize the substantive demands they have in the region? Right. Because this demand can be used to leverage volume. And with volume, you can then articulate interest from private sector to be able to make their products available and reduce the price per unit if there's a way for us to create a form of framework agreements in terms of accessing supplies. Because right now, most procurement is ad hoc, case by case, unit by unit, order by order. There's no planning, there's no strategy. It's all driven by the individual. We come, they get assessed. Aha, here's your need. You need XYZ. The patient orders XYZ. They then order that, and nobody has the finance to stockpile volume. We have to have an order-based system. For that to be of interest to markets, they need visual, they need planning, they need to see what the demand will look like in a year. And there are examples. If you look at how the UK government has framework agreements on the ordering and supply of prosthetics. Look at how many countries, including France and other countries, including Romania, on how they articulate a visual on the demand. And because countries are so small and the economies are small, the more they can pool a visual. I'm not saying pool procurement.
Right.
Procurement is done. I'm talking about pooling a visual on the demand, because the more we have common standardization, quality standards, as Jeremy Gaskell, it was a pleasure to see you, Jeremy, in terms of getting an even playing field where we all adhere to the same quality standards, because then we stop and we get out of the market the inappropriate items. How can we still have logarithmic the hearing amplifiers, which are detrimental to hearing aids? So there's a lot of products out there which should not be there, because we don't visualize demand, we don't visualize regulate the environment, because we can win. There are some quick wins to be had. I leave it there, and obviously can expand more. And
thank you very much, Adrian, and the importance of the untapped potential of not recognizing demand and how that demand actually translates into market shaping, and that's an untapped area. And I think this is something which can bring countries together, regulate the environment, and shape the markets better, and that can be facilitated through various agreement processes. So thank you very much, Adrian, for that, for responding to that question. I thank everyone for this exciting discussion, and apology for running over time. My colleagues have already posted in the chat. The English report is available online, Guide for Assistive Technology Market Assessment and Shaping, as well as the report from the two countries, Georgia and Tajikistan, is already available and it's been shared in the chat. The webinar recording will be publicly available on the ATscale website and social media, as well as WHO website. This is something which was also asked in the questions. Colleagues and participants, this is the third conversation in the discussion series, and many more conversations are going to come up with regards to market shaping. The next webinar in market shaping series is expected to be focused on local production, which is again a very hot topic, local production and assembly, and will be scheduled shortly. We hope to continue working with those present here and continue this conversation on building healthier assistive technology market globally. Thank you very much, everybody. Have a great day, evening, and night ahead, depending from where you are joining in. Thank you very much.